How about my laser point? Is it visible? Is it visible?
Yes po.
Okay. So, what is the endocrine system? No? So, this is a group of organs, okay, which are described as ductless. So, when we say ductless, okay, they do not, okay, the products it produce or secrete, it does not pass any ducts, no, but rather it would be released on the surface, no, of these endocrine glands. And they are very important because they regulate the water balance of our body, uterine contractions, okay, they also regulate our growth, iron regulation, and they also contribute, no, to heart and blood pressure regulation, plus the blood glucose control, contribute immune system and okay, in the immune system, and also regulate the functions of the reproductive system. No? So we classify them into two. Okay, those that are merely or exclusively, no, okay, perform endocrine, okay, functions. These are your pituitary, or they are classified rather as primary endocrine glands. And these are your pituitary gland, your pineal glands, no? Okay, there. There's your pituitary. Okay, your thyroid and the parathyroid glands. Okay, then the rest, no, okay, they have other functions or they have dual functions, like the case of your pancreas, okay, it has both exocrine and endocrine functions, no. Your renal case, okay, on the top of that you have your adrenal glands, the testes, no, and the ovaries, no. So these four, okay, or even the heart and the thymus, okay, they are classified as secondary, no, endocrine glands. Naintindihan ba, class? Ulitin ko ha. So we classify the endocrine glands into two, those that primarily function as endocrine glands, okay? These are your pituitary, okay? Your thyroid and parathyroid, no? And pineal. So meaning to say their main functions or their only function as an endocrine gland. Now the rest, they are classified as secondary because they have other functions aside from secreting or producing, no, endocrine substances or rather hormones. Okay, did you get it? So again, no? So they are classified as endocrine glands. And if you will go back to the first meetings, no? Okay, we discussed, okay, the introduction to tissues, okay, under the classification of epithelial tissues, the endocrine glands are ductless, no? Okay, and the substance, no, or the chemicals produced, they are called as hormones, no. So they act on their target organs in order not to regulate the different areas of the body. So the hormones, no, they serve as chemical signals, no, in order to initiate, okay, a response, no. Those that are that acts, no, inside the cell, okay, they are classified as intracellular chemical signals, where they bind to receptors, okay, and the products they produce would travel, okay, from okay, the secretory organ, and that would join, no, or the after releasing its substance, it would go, no, with the blood circulation to reach, no, okay, the target organ. When we say intercellular, okay, these are the hormones, no, that are produced by one cell, then that would be thrown to the intercellular fluid, no. Okay, so these are the autocrine and the paracrine. When we say autocrine, the organ produce its the hormones, okay, and would act on the same, no, cells, secretory cells. While that of the paracrine, they would be released, okay, on the surface of the organ, and those organs that are adjacent to them, they would act, no, okay, on the organs adjacent to them, no, okay. Now we have, no, these two types of substance produced by the endocrine glands, and these are the hormones and the neurohormones, no. So are you still okay? Am I still at the GMIT class? Am I still at the GMIT?
Yes, ma'am.
Yes po.
Pasensya na kayo ha, kasi medyo masama yung pakiramdam ko. So, parang congested yung ilong ko, no? So parang na ano yung inhale and exhale ko, no? So I'm having a hard time speaking. Okay, so let's start first with the pituitary gland, no? So if this is your cerebrum, okay, that is your corpus callosum, that's your diencephalon, okay. You have there your hypothalamus, no? So this is a large picture of your hypothalamus. It is connected, no, to your pituitary gland. So this is your pituitary. And we divide the pituitary, no, into the anterior lobe. We call this your adenohypophysis, while that of the posterior lobe, we call this as a neurohypophysis, no? Because the neurohypophysis or this posterior lobe, they are derived, no, with the same tissues of the brain. So that's why it is called neuro. Okay. Now here, okay, that is your adenohypophysis. By the way, no, okay, the entire organ that is your pituitary. Another term for that is hypophysis. No? So it lodges on the hypophyseal fossa of the sphenoid bone. No, and this is uh, described as the master gland of the body, which we will discuss later. No, okay. Now here, no, again, as I've said, it is divided into your anterior, we call that your adenohypophysis, and the posterior, we call that the neurohypophysis. Now, the adenohypophysis or the anterior lobe is composed of three, no, parts. So the biggest part, that is your pars distalis, okay? This is your pars intermedia, and this is your pars tuberalis, no? Okay? So the posterior lobe isa lang, no? Okay. Buong yan, that is called as your posterior lobe or your neurohypophysis. Okay. Now, what about the function of your hypothalamus, no? So the hypothalamus would produce, okay, the releasing hormones that would stimulate, no, the different cells within, no, your pituitary gland. And that is why, okay, it your pituitary, no, is called your master glands because almost all of the organs of the body, they are regulated by the hormones produced by the secretory cells present, no, within your anterior lobe. Did you get it? Did you get it why it is called the master gland? Naintindihan ba? Do I need to repeat? You want me to repeat, class? Hello, are you still there?
Yes, ma'am.
Ulitin ko pa ba? Hindi na.
Kahit di na po.
Kahit di na. Okay, so let us proceed, no? Now, if you would notice, you find tracks there, no? Okay. Supply, the blood vessel supply, okay, your pituitary lobe, no? And these blood vessels are derived from your superior hypophyseal artery, which supply, no, your tuberalis, okay, part of your infundibulum, okay, and we have also, no, the blood supply coming from the inferior hypophyseal artery, which supplies the posterior lobe. No? Now, why are these important? These blood vessels important, no? So aside from giving nourishment, no, to their areas, no, the designated areas, okay, they also conduct, okay, the hormones, no, produced from the hypothalamus, the releasing hormones, no, to be distributed to the different areas of both your anterior lobe and that of the posterior lobe. So again, these are composed, okay? These tracts are, or rather, portals of blood supply, no, are coming from your superior hypophyseal and your inferior hypophyseal. So you take note, no? The superior hypophyseal artery would form, no, your plexuses. So these are your plexuses. First the primary and that of the secondary plexus. Okay. Now, what about this, no? Okay, the green colored structure there, we call this a tract, no? So within your hypothalamus, you have your supraoptic nuclei and your paraventricular nuclei, no? So their axons, okay, are directed towards the posterior lobe, no? Because the posterior lobe do not produce, okay, its own hormones, but rather these two nuclei within the hypothalamus are the ones, no, which produces, okay, the posterior lobe hormones. Did you get it? So they would now pass here through your hypothalamic. This is your hypothalamic tract, the green ones, and the hypophyseal blood vessels. We call this your portal system. So the whole structures, no, okay, they are called as hypothalamic hypophyseal tract. Okay, again, what is the significance of this? They convey or they conduct, no, okay, the hormones down to the anterior lobe and that of the posterior lobe. Did you get it? Okay, so this is only, okay, the detailed, no, okay, description on how, no, your hypophyseal hypothalamic tract, okay, delivers, no, okay, their product from the hypothalamus down to your pituitary glands. Okay. Now, what are the hormones, no, produced by your hypothalamus, no? So these are your releasing hormones, no? So it produces your tyrotropin releasing hormone or TRH, okay, which okay acts on the thyrotropes on the pituitary gland, no, to produce or stimulate the thyroid stimulating hormone. Another is your gonadotropin releasing hormone, okay, which stimulates the gonadotropes in the anterior pituitary to produce the FSH or the follicular stimulating hormone and the LH. Another is your corticotropin releasing hormone, which stimulates the corticotropes on the anterior pituitary to produce your ACTH, your growth hormone releasing hormone, okay, which stimulates your somatotropes to produce or stimulate the growth hormone, your hormone inhibitory or your somatostatin, okay, which would inhibit your somatotropes, okay. Then you have your prolactin inhibiting hormone, okay, which inhibits the secretion of prolactin. And of course, you have your not written here is your prolactin stimulating hormone, which would act on the on lactotropes to produce prolactin. Okay? So, naintindihan ba ako? Naintindihan ako? That are you
Tama.
raising your hands?
Ma'am, ano po, meron po bang explanation po in layman's terms para po sa function ng hormones?
Ito pa lang. Itong page na to.
Sige.
Ito. Okay. So let us now proceed to the process, no, on how, okay, these hypothalamic hormones, no, would stimulate your, okay, pituitary hormones. So we have there, no, your these are your releasing hormone produced by your hypothalamus. Okay, let us take one. Okay, your thyrotropin releasing hormone. We have here, okay, that within the anterior pituitary, several no cells. Okay, your thyrotropes, okay, which is responsible for producing your thyroid stimulating hormone. You have also there your lactotropes, which is responsible no, for stimulating your prolactin. Then you have your gonadotropes, which produce your FSH and LH. Your your somatotropes, no, which produces the growth hormone. And lastly, we have your corticotropes, which produces your ACTH. So, paano ngayon, no? Okay. So, once these hypothalamic hormones, which I already given you, okay, stimulated their respective, no, uh, hormone secreting, no, cells within the anterior pituitary, okay, it would now cause no, or release the stimulating hormones of its respective organ. So in this case, let's take first the thyroid, okay? Your thyrotropin releasing hormone as it is stimulate your thyrotropes, okay? The thyrotropes here present in your thyroid gland would produce your thyroid stimulating hormone. And this thyroid stimulating hormone, no, okay, would act, okay, on the target organs. So what are the target organs? So first we have the different organs like the muscles, which would increase the basal metabolic rate. Okay, what else? No, It also it would stimulate the hormones that would regulate the blood calcium, no? So those are the functions. Now, how about your prolactin stimulating hormone? So it would act on the okay your lactotropes, and these lactotropes would produce your prolactin. Now, what is the function of your prolactin? No, so it would stimulate the mammary glands, okay, to produce milk. Okay, so that's why your prolactin is responsible for what? Milk secretion. Did you get it? The one who asked the question. Are you with me? Are you still with me? Nasusundan mo ba ako, Iho?
Yes
Iho?
po. Thank you. Yes po.
Okay. Now, what about, no? Okay, your gonadotropes, no? So your gonadotropin releasing hormone from the hypothalamus would stimulate your gonadotropes here, no? That's your pituitary. And these gonadotropes, okay, would now produce your FSH and your luteinizing hormone, which would stimulate the development of gametes in male. We call that the sperm. And in female, they have their oocytes. Okay? Now, what about, no? Okay? Your corticotropes, again, your corticotropin releasing hormone. That would stimulate your corticotropes present here in your anterior pituitary, okay, to stimulate your adrenal gland, no? Specifically the adrenal cortex to produce your ACTH. And this in turn would act on the, okay, our adrenal cortex to cause the release of your corticosteroids. And lastly, you have here, no, your growth hormone releasing factor, which would again stimulate here a cell, your somatotropes there, and that was stimulate, no, the release of your growth hormone, which would act on the liver, the muscle, and that of the adipose tissues, okay, and even bones, no, to stimulate growth. So those are, no, the functions of the different hormones of your anterior pituitary gland. So yung sa hypothalamus, ang tawag sa kanila, releasing hormone, no? Pag sumobra, we have another type of hormone. We have the inhibiting hormone. Okay? Itong mga cells, okay, dito sa anterior pituitary, ang last name nila, tropes, no? So if it arise from the thyroid, okay, it is your thyrotropes, okay, if that is the target organ, the thyrotropes, your lactotropes, okay, for the breast, okay, your what you call this, your gonadotropes here are the cells which produce your FSH and LH. Then you have your corticotropes, which would produce your okay cortic ACTH, no, and your this one is your gonadotropes, no, rather your somatotropes, no, for the growth. Okay, so naintindihan ba ako? Naintindihan ako? Ha? Naintindihan ba ako?
Yes po.
Okay, what about the posterior pituitary? This one, no? So the posterior pituitary, okay, as I've said, they are not, okay, this is the endocrine part, no, which does not produce its own hormone, but rather the hormone is derived, okay, from the hypothalamus, wherein you have your supraoptic nuclei and your paraventricular nuclei. So the supraoptic, okay, would produce your what? No, it would produce your hormones, no, your oxytocin, while that of your paraventricular, your antidiuretic hormone. Okay, so your antidiuretic hormone, no, would act on the kidney to increase water resorption in the kidneys, while the oxytocin would act on the breast, the uterus, and that of the spermatic cones, no. So that, okay, the oxytocin would lead to, okay, milk, no, ejection. Yung isa, yung prolactin kanina sa anterior lobe, that is for the production of milk, while the oxytocin, no, I would like to emphasize that, okay, is for the milk letdown, no, para bumaba yung, para lumabas yung milk. And it will also act on the uterus for contraction. So this oxytocin, know that they are stimulated during the last trimester of pregnancy, in order to help, no, okay, contraction of the uterus, no, to facilitate, no, the descent of the baby, no. And at the same time, after delivery, the oxytocin, no, would contract the uterus to prevent further bleeding or hemorrhage. Did you get it, class? Did you get it? Okay. Now, paano, no? Mangyayari to, no? So you have there again, let's go back there. So you have your supraoptic neurons. This is your hypothalamus. That is your paraventricular neurons, no? So, okay, if it would be stimulated, no, okay, like for example, during the delivery of the baby, sino ba rito nakakita na nanganganak or nasama na sa delivery room? Meron ba? Meron ba dito? Naka-experience na sa delivery room? Wala pa?
Wala pa yata, ma'am. Pero video
Next
clip, ma'am,
year,
nakapanood na.
next year meron na kayong yatang clinical exposure. Meron na ba? Sige. Kung wala pa, okay lang, no? So, during the delivery of the baby, no, okay, the those within, no, the vicinity, yung mga nurses, mga midwives, okay, they put the baby near the breast of the mother, no? So, the baby would they have their reflex na pag nalapit do sa breast, okay, they have their suckling reflex, no? They suckle the breast of the mother. And the suckling, okay, of the breast would stimulate, no, okay, your supraoptic neurons, no, okay, to produce oxytocin. And this, no, okay, oxytocin would cause, okay, or would lead, no, to ejection of milk, no, or rather the milk let down. Okay, so makakasuso yung bata, makakakuha siya ng milk sa mother. At the same time, no, during that okay, milk let down, no, okay, the oxytocin would also act on the uterus. So that would cause the contraction of the uterus of the mother. Okay, since okay during delivery when we remove the placenta, there is too much bleeding, no. Now the oxytocin, okay, upon the suckling of the baby, okay, upon letting the baby suckle the breast of the mother, okay, the oxytocin now, no, would act on the uterus of the mother, so that would there would be contraction, and this could cause, okay, constriction of the blood vessels of the uterus, okay, preventing, no, further bleeding. Okay, so that's why from the action potential from the suckling, it would send there your information, okay, stimulate this nuclei, no, your supraoptic in your hypothalamic, and that would now be brought down, no, okay, your oxytocin now would be brought down to the posterior lobe where you have their temporary storage site, the herring bodies. Okay? Now, if there is a continuous stimulation, no, okay, for this oxytocin, that would be released and act on a target organ, which are your breast, okay, the breast of the mother and that of the uterus. Did you get it? Did you get it, class? Naintindihan?
Yes
Naintindihan
po.
ba ako? Okay. Now, let's proceed to the second, no, endocrine gland. And this is your thyroid gland, no? So your thyroid gland, it is located at the base of your trachea. So that is your trachea. So they are located on the lateral side. We have two lobes, the right and the left lobe, which are connected, no, by your isthmus. So that is your isthmus. Now you see that round structures, okay? Those are your thyroid follicles, no? So if you would look at it under the microscope, this is how it looks like, no? So this is one thyroid follicle, okay, another thyroid follicle, and so forth, no? Okay, now these are the epithelial linings, no? So the epithelial linings are called your follicular cells. So the follicular cells are responsible for producing your thyroid hormones, your T3 and T4. Okay, but there is another, okay, cell inserted within your follicle. We call that your parafollicular cells. And these parafollicular cells produce another hormone. We call that calcitonin. So tatlo ha, tatlo yung hormones niya ha. So we have your T3, your T4, and your calcitonin. Okay, nasusundan ba ako? Nasusundan ba ako, class?
Yes, ma'am.
Yes,
Okay.
ma'am.
Now, your thyroid hormone, no, and the rest of the endocrine, they are regulated by what we call as negative feedback, no? So we will discuss this a little later, okay? So before we proceed to that process, okay, these are the effect of your T3 and your T4. So because it would increase, okay, the basal bad metabolism, no, okay, it would increase, no, that okay, those okay, metabolism, no, would cause or okay, increase the body temperature. So it also has a function, or it also has an effect on the heart, like it would increase, no, okay, the heart rate, no. So this is what I was saying a while ago, no. In order, okay, to produce more heat, there should be an increased basal metabolic rate, no. So ano yon? Ano ba yung mga basal metabolic rate niyan? So lahat yan yung digestion, no? Yung metabolism, that the end effect of digestion, that is basal metabolic rate. The contraction of the muscle, that is basal metabolic rate. Did you get it? Now, it also has an effect on carbohydrate metabolism because we need energy, no, for these two, no? Okay? So there is an increased glucose, okay, which would be converted to fuel, no? The same thing with that of the protein metabolism. So there would be anabolic reactions, no? Lipid metabolism and so forth. Okay, so but these one, two, three, four, five, these are the very important, no, functions of your thyroid hormones. Did you get it? Okay. Now let us proceed here. So we have here your negative feedback. So paano ba yung negative feedback? Okay? So for example, okay, there is a decreased T3 and T4 in the blood concentration. So which leads to a very low body temperature. So if there is a low body temperature, okay, and low T3 and T4, okay, there is a signal that would be sent, no, or the signal would be sent to your hypothalamus. So this would now, okay, initiate the release of your hypothalamic releasing hormone. So in this case, your thyroid releasing hormone. Okay? So your thyroid releasing hormone would act on your thyroid troops present on your anterior pituitary. And your thyroid troops now would begin to produce your TSH, or thyroid stimulating hormone. Now, the thyroid stimulating hormone would act on each thyroid follicle, okay, to produce more T3 and T4. So if there is an increase in the amount of your T3 and T4, that would act now, no, on the different organs of the body to increase the basal metabolic rate, and that increased metabolic rate would lead to increased body temperature. So if there is already a high, okay, um, basal metabolic rate and body temperature, again, that would send, okay, an information to the hypothalamus to inhibit now, this time inhibit the release of your thyroid releasing hormone. So that is what we call your negative feedback mechanism. Did you get it? Naintindihan ba, class? Naintindihan? Naintindihan? Hoy,
Yes po.
how about the rest of the class?
Yes po.
Okay. So, what about your parathyroid, no? So, if you turn, okay, your thyroid gland and look at it posteriorly, so we have on the upper poles and the lower poles your parathyroid glands. So, these are your parathyroid glands. This is the back of your, or the posterior side of your thyroid gland. So, again, no, this produce your hormone. We call that the parathyroid hormone. So the same thing with that of the calcitonin, no? It regulates the blood calcium level. Okay? But more, okay, But this is more on the function. No, the blood calcium level is more regulated by the parathyroid compared with that of your calcitonin. Okay, so your parathyroid hormone now, okay, would act on the bone, okay, the kidney, and that of the intestine. Okay, so if there is a low no blood calcium level, your parathyroid hormone would be stimulated, and it would cause okay a efflux of calcium from the bone. So it would okay stimulate your osteoclast, okay, to for calcium resorption. No, so when we say resorption, it would remove the calcium from the bone so that the calcium would go to the bloodstream. Did you get it? Okay. Now, what about no in the kidney? Since okay, the calcium already is in the blood, okay, then it would now be filtered no within the kidney. But the kidney would prevent okay the excretion of calcium. Okay, so that okay, the calcium is still elevated, no? And at the same time, it increase okay absorption of calcium in the intestine. Did you get it, class? Did you get it? Did you get it? Can you follow? Are,
Yes po.
are you still with
Yes
me?
po.
Okay. So, ito, pagsamahin natin yung action ni calcitonin at saka ni parathyroid hormone. So, for example, no, the calcium level in the blood rise above no, the threshold. So, that would now, okay, send the message to your thyroid gland to release your calcitonin. Okay, what is the action of your calcitonin? No, it would now decrease. No, okay, the blood calcium level by what? Okay, it would stimulate your osteocytes. Okay, so the osteocytes, okay, would prevent no the release of calcium from the bone. Okay, now what if there is a very low calcium level? Okay, below no the threshold. Again, that would be recognized by your parathyroid hormone, okay, to produce, okay, by your parathyroid gland and to produce your parathyroid hormone. Now, the parathyroid hormone again would act on the osteoclast, this time the osteoclast, okay, to, okay, resorb, no, more calcium from the bone. And therefore, no, the calcium would go to the blood circulation to increase its level. Did you get it? Did you get it, class? Naintindihan ba ako? Ha?
Yes po.
Okay. Now, what about the kidney? No? So this is your kidney, but our concern is this structure or the hormone no, located in the superior pole of the kidney. So we call these glands as your adrenal glands or your suprarenal glands. No? So if you get this, okay, cut it transversely, this is how it looks like. No? So we have the two layers. The outer layer, we call that your adrenal cortex. The one at the middle, we call that your adrenal medulla. Okay. Now let's start first with that of the cortex, no? So if that is the capsule, just beneath the capsule, we have here, that's your capsule. This is your zona glomerulosa. Okay? Zona glomerulosa, okay? Release mineralocorticoids, no? So the hormone produced is your mineralocorticoids, and it is best exemplified by your aldosterone. So this would regulate no, the mineral balance within the body, specifically the sodium, no, okay, electrolyte. Now, beneath your zona glomerulosa, this area here, that is your zona fasciculata, no? Okay, so this produces a steroid which we call glucocorticoids. And this is, okay, steroids regulate glucose metabolism. So good example of these, okay, are your cortisol, corticosterone, and cortisone. And the innermost layer of your adrenal cortex or adrenal gland, okay, at the cortex area, that is your zona reticulosa. So this produce small amount of androgens, no? which contribute to secondary sexual male characteristics, no, for masculinization. So best exemplified by your dehydroepiandrosterone. Did you get it? Are you still with me? Are you still with me?
Yes, ma'am.
Okay. So let's start first with that of your mineralocorticoids. So sabi natin, okay, that is your aldosterone. So this is their main important or main function, no? So it okay regulate electrolyte homeostasis and water balance. So the target area specifically on the kidney is the distal, no, tubules, but it can also, okay, regulate the salivary glands and sweat glands secretion in order to act or to reabsorb the sodium, no? Okay, so that is the main function. So if we will go back to this, okay, within the kidney is your JG apparatus, no? So the JG apparatus is very sensitive, okay, to the volume, no, of fluid within our body, which, okay, is associated, no, with the blood pressure and the blood flow to the kidney. Okay. Now, if there is a decrease, okay, blood volume, okay, that would be recognized by your JG apparatus, and that would stimulate your angiotensin. Okay. Now, the angiotensinogen is an inactive form. Okay. It would be activated into your angiotensin 1. And this angiotensin 1 would be converted in your angiotensin 2, no? Which would stimulate the, okay, zona, no, glomerulosa of your adrenal cortex. Okay, now it has two effects. Okay, it can vasoconstrict the blood vessels so that there would be an increase of blood pressure and increased blood volume, or it would act on the aldosterone, okay, to, okay, make sure that there is more retention of sodium. Now, what is the effect of sodium is to attract more water. So if there is more sodium, more water would be retained in the kidney and there would be an increase in the blood volume. Did you get it? Did you get it, class? Naintindihan? Ha? Nasusundan ba ako? Hoy, tahimik kayo. Siguraduhin nyo nakikinig kayo kasi itong mga to medyo complicated to and they would give this in your exam. Are you still with me? Am I still at the GMeet?
Yes,
Yes,
po.
ma'am.
You can take down notes if you want, no, for additional information. Okay? Now, let's proceed to your fasciculata. No? So, that is your fasciculata. So, this produces your, okay, cortisol. No? So that is your glucocorticoids, okay? And it has an effect on the carbohydrate metabolism, protein and lipid, and stimulation of gluconeogenesis. Sorry for the spelling. I just got this from the Google, no? Okay. Now, what would be the effect, no? So the amino acid would be mobilized, okay? And that would it would also inhibit the glucose uptake, no, in the or the storing of glucose in the muscle and the adipose tissue. Okay? At the same time, it would break down fat, no, in order to produce more energy. Okay? Now, what about on the immune response, no? It also contribute to the immune response. It destroy the circulating lymphocytes and prevent mitotic activity. Okay? Now, we can also use this glucocorticoids, especially in cases where there is premature, no? Okay, um, premature babies, no? Let's say, nagkaroon ng premature, what they call this, yung delivery, no? Premature delivery or na tawag dito, active contraction na yung uterus ng mother, no? Premature labor na yung mother. And yung ano, age ng baby, hindi pa siya dapat siguro lumabas, no? Dapat mga 7 months pa lang siya or 8 months. So, meaning to say, the lungs is not yet or the lungs are not yet matured enough to produce a surfactant. So, we give this, no, your glucocorticoids, no? We inject this to the mother to stimulate the maturation of the fetal lung, no? because during it is only during the matured, no, or well-developed lungs would this fetal lung produce the surfactant. Okay, did you get it, class? Did you get it?
Yes po.
Now, what about the androgen? No? So they are okay, produced, no, by your zona reticularis. So this is only a small amount, no? Okay. So these are found both, no, or secreted both, no, in male and female, no, zona reticularis. So they are in the form of the hydroepiandrosterone, no. So actually, this is one of the components if we are giving contraceptives among female. No? Now, what would be its effect on male? They contribute to the secondary sexual characteristics. No? So the more you have their androgen, okay, you notice that male individuals are prone, no, to baldness, and that is because of the presence of androgen. The same thing in female, no, it also affects female individuals, but this time it is more on the female sexual drive. Did you get it? Now, what about the medulla? Okay, so that is the core of your adrenal glands, no? So this time, okay, it has our chromatin cells, okay? So the chromatin cells are the same, no, with the other nerve cells within the nervous system. They contain sympathetic ganglion cells, no? So if that is sympathetic ganglion cells, okay, we need to say they are associated in the production of your sympathetic, the neurotransmitters, your epinephrine and your norepinephrine. Now, we call these neurotransmitters as catecholamines, no? The epinephrine and the norepinephrine. Okay. So they are involved, no, in your fight or fright reaction, no, which causes an increased heart rate, vasoconstriction of most systemic arteries that can also affect your breathing, no? If you are angry, no? Di ba napapansin niyo? There is an increase in respiratory rate and there is more depth, no? Okay, as you inspire and expire, no? And there is also an increase in muscle contraction. Okay, now what about your norepinephrine? Actually, it goes with that of the epinephrine, no? So your norepinephrine also stimulates your gastrointestinal contraction to release more glucose. Okay, increase blood pressure also, no? So how would be the reaction here? So if you are stressed, okay, that would excite your hypothalamus, no, to release, okay, your releasing hormone that would stimulate, okay, your pituitary gland, okay, and that would, okay, your corticotropes present here in your anterior pituitary would act on your adrenal gland, no, okay. So for it would first, okay, it would stimulate your fasciculata, okay, then the fasciculata, no, would further mobilize your glucose, no, okay, it's your fat mobilization, okay, in order, no, to tawag dito yung para ma-carry mo yung physical stress mo. Okay? But in actual, okay, it your hypothalamus, no, as it is stimulated by the stress, okay, would stimulate your catecholamines, no, to produce more epinephrine and epinephrine. And again, that would now target its organs like the liver to release more glucose, the fat stored there, increase heart rate, decrease blood flow, okay, decreased functions of other vital organs, increased blood pressure, and increased metabolic rate. Okay? So, that's it, no? Okay? Now, what about the pancreas? Am I too fast? Okay lang. Nasusundan niyo pa ako, class? Nasusundan niyo ako?
Susundan po.
Yes.
Po.
Okay. What about your pancreas? This is your pancreas. That is the duodenum, no? So the duodenum is divided into four segments, but this is the second part of the duodenum where we have the head of the pancreas. Okay, that's the head. This is the body, and that is the tail. Now, it has a dual function, no, your pancreas, no? It is both exocrine and endocrine gland. We will discuss the exocrine gland when we are already in digestive system together with the major pancreatic ducts, no? But at this point, we would only concentrate on the endocrine portion, no? So if we will get the portion of your endocrine gland of your pancreas, okay, this is your islet of Langerhans, no? The reason why it is called islet, okay, it looks like an island surrounded by your pancreatic acinar cells. Okay. So ito lang yung endocrine portion. Okay, so that is your islet of Langerhans or pancreatic islet. It means the same. Now you have two major cells present here, the alpha cells which produce the glucagon and the beta cells which produce the insulin. Okay, what's the function of your insulin? Okay, so dito lang tayo sa green. Okay, so the insulin, it is stored extra glucose. No? Ini-stored niya, no? In a stored form, okay? So that is your glycogen. So these are no the effects. It would increase glucose uptake, okay, to store it in the form of glycogen. That's why you call that glycogen synthesis. Now, aside, okay, from the glucose synthesis, it would also no, produce protein synthesis or enhance fat synthesis. Those two would also be stored, no? Okay. Now, the glucagon, okay, would increase the blood glucose level. The insulin would decrease the blood glucose level by glucose uptake or storage, while the glucagon, it would release more glucose to the blood circulation. So what happened here? Okay, it would break down no the stored glucose and fats, so called that your glycogen synthesis. Um, Rather your gluconeogenesis, glycogen mobilization, ketogenesis, protein degradation, and uptake of amino acid. Only the green ones. No? Okay. Ulitin ko yung insulin, binababa niya yung blood glucose level by glucose uptake or storage or glycogen synthesis, protein synthesis, and fat synthesis. Si glucagon, ini-increase niya yung blood glucose level by gluconeogenesis, glycogen mobilization, ketogenesis, protein degradation, and uptake of amino acid. Okay? So what happened here, no? So for example, there is a high blood glucose. Okay, so that would be detected by the pancreas. So specifically, no, the insulin producing cell, that is your beta cells, no? And these beta cells will stimulate glucose uptake from the blood. Kukunin niya yung mga glucose, okay? And that would be stored temporarily in the liver. Okay, so therefore you would lower the blood glucose level. What if there is a very low blood glucose level? No? So this stored glucose, okay, would be released there, no, in the blood, okay, by means of stimulating the alpha cells in your pancreas, no. So the alpha cells would produce more glucagon, and that glucagon would break down the stored glucose in the liver, okay, to raise no the blood glucose level. Did you get it? Naintindihan ba ako? Nasusundan ba ako, class?
Yes,
Hello?
ma'am.
Okay. Now, what about your reproductive system? So we have here their main function is for copulation, no? Okay. But the endocrine part, okay, in male, it is within the testes, and in female, that is within the ovaries, no? Okay. Now, what is there in the testes, okay, are the interstitial cells ovulating, no? So your FSH, okay, hormone is produced, your gonadotropes would produce your FSH, which are found in your anterior pituitary, and that would target the seminiferous tubules. The seminiferous tubules are found in the testes, and they are responsible for the production of sperm cells. Okay? Now, it also produces the interstitial cell stimulating hormone, huh? which would act, okay, on the interstitial cells of Leydig. So these cells are found in between, no, two or more seminiferous tubules. Nasa gitna siya. So these are, okay, cells are responsible for testosterone production. Okay? Now, what would be the effect of your testosterone? Okay, so in male embryo, it would allow descent of the testes. They are also responsible for primary sexual characteristics and secondary sexual characteristics. Yung primary sexual characteristics, okay, yan yung mga nagmamatured yung male reproductive organs, no? Pag sinabi naman secondary sexual characteristics, ito yung nakikita natin sa panlabas, no? So there would be distribution of body hairs or baldness, or there would be an effect on the voice, no? And the same thing with the skin. And you would notice that the male individuals, they are heavier, and the muscles are more broader, no? The bones are much heavier and bigger, no? And they have more or increased basal metabolic rate, the same thing with the increased number of red blood cells. Okay? Now, in female, no, although the FSH also, no, has an effect on the gametes of the male, okay, in this slide, no, we just describe this in female so that you won't be confused, no. So the anterior pituitary would release your FSH and LH. So your FSH, that would stimulate the follicular growth in ovaries, and if the ovaries or the follicles in the ovaries are already matured, they would produce the female hormone called estrogen, no? Okay, it also, their anterior pituitary also produce the LH, okay, which would, no, okay, indicate, or which would trigger ovulation, no? Okay, then on the ovaries, okay, when the estrogen are already produced and the progesterone, your estrogen and progesterone now would act on the uterine lining, which we call as endometrium. So these two, no, okay, they regulate the menstrual cycle and ovulation of each female individual. Okay? Now, lastly, we have the pineal gland. No? So if that is your pituitary, opposite your pituitary, you have your pineal gland. And your pineal gland produces your melatonin. So they are the one responsible for the alternate sleep-wake cycle. No? Okay, so when you sleep, okay, you resume, no, your strength or your immunity because it regulates the blood pressure, it serves as an antioxidant, and it has an anti-inflammatory effect. Okay, now we have another secondary endocrine organ here, and that is your thymus, no? So among young individuals, okay, this is active, no? But as one gets older, this will be converted into fats, no? So they are located there at the mediastinum, and this produce your hormone thymosin, no? Which helps in the development of your T cells, no? Okay, the body of the body. So that's the last, okay? Any question regarding this topic? Any question?
None po.
Nasundan ba ako, class? Nasundan ako?
Yes po.
How about